Viewig, manager of the Ranucci Hospitality House. I want to thank you for your participation with the LEAD program and your interest in what we do here at the house. We are a home away from home for families who travel distances to seek care at Helen DeVos Children's Hospital and Spectrum Health. We have 37 rooms here. It costs $45 a night for individuals to stay here. With the kind, generous donations of individuals like yourselves, we are able to help others who may not be in the position to afford the accommodations here. We provide a respite and a place to lay their head. I want to thank you for your consideration of your generous donation to Ranucci Hospitality House, knowing that it will help others in the future on their journeys at Spectrum Health and Helen DeVos Children's Hospital.
When I was first diagnosed with a blood disorder in Saginaw, there was some, I don't say confusion or some doubts, what is this really? And that's kind of led me here to Grand Rapids to Spectrum. And the experts here were able to really pinpoint it. And I had aplastic anemia, which is quite rare. And we followed through, and I had a bone marrow transplant. Stem cells were donated by my brother, and who turned out to be a perfect match. And all's well, as I am in the recovery stage now.
When I first came here, I wasn't sure I even wanted Ranucci House. I thought it was going to be very difficult being in the hospital all day with Jim. I wanted to come to a place where I didn't have to think about anyone being sick. I didn't want to have to hear anybody else's problems. And on the contrary, Ranucci has been wonderful. There's a wonderful support group there. Anything you need, if they don't have it, they will get it for you. But I'm very proud of him and just forever grateful to the entire staff here. We couldn't have picked a better place.
Hi, my name is Michelle Lancaster. I'm a nurse navigator, care coordinator at Helen DeVos Children's Hospital in the Secchia Care Partners program. Secchia Care Partners is a nurse navigation program. We help children with medical complexity navigate the healthcare system. Our program is 100% free for patients and funded through philanthropy. Your donations in dollars really do help our program survive and allow us to provide this really individualized, specialized care for families that are going through difficult times. So we want to say thank you so much for coming and learning more about our program and for considering this program in your future donations. Tynesha is an amazing mom. She really responds to the special needs that Haley has in a really sweet way.
Haley is, oh my God, busy, fun, exciting, and she's always surprising me. And she's just everything to me. Like, I just love Haley.
She has a pretty severe seizure disorder, and they travel to Helen DeVos Children's Hospital frequently for multiple specialty appointments that they have. And so we are their one point of contact instead of having to call 4 or 5 different specialty providers. Tynesha is able to just give me a call and we make that happen for them. The families that I am privileged to work with, it's just so humbling to see them go through their day to day, the challenges that they're faced with every day, the fear that they live with on a daily basis for these really fragile kids. I am in awe on a daily basis of what these families are juggling.
I just want to thank them. Just thank them so much for all their help, everything that they do, as far as the meals, the giving you a place to feel at home, like just everything that they do. Just thanks.
Hi, I'm Elaine Bauer, Director of Betty Ford Breast Care Services. I'd like to thank LEAD for allowing us to present our Betty Ford Breast Care Services program, as well as the services that we provide on our mobile mammography unit. If you were able to attend this session, you learned that we provide free mammograms and free diagnostic services for patients who may be medically underserved or may be uninsured or underinsured and have particularly high deductibles. So we're very interested in increasing access not only to advanced technology for this population, but access to quality breast care services.
With all the comforts of your top-of-the-line luxury RV, this mobile mammography unit is in the business of catching breast cancer in communities everywhere. On top of the 14 locations across West Michigan, there are now 2 mobile units that will travel between 26 Meijer locations in the state. Women can schedule their appointment online or
They can come and knock on the door, absolutely. We have a registration person who is also our driver, who can take care of them, get them registered, and we can get them right in.
With 2D or 3D or tomosynthesis technology, patients won't be taking a shortcut by choosing the mobile unit over a traditional doctor's office.
Thank you for your interest in Betty Ford Breast Care Services.
Hi, I'm Joan Rickley, and I'm the director of the Neonatal Intensive Care Unit at Helen DeVos Children's Hospital. I'm delighted to spend a few moments with you talking about our amazing NICU. We are very large. We have 108 beds. We're the largest neonatal intensive care unit in the state and one of the biggest in the country. We care for about 1,500 babies and their families each and every year, ranging from premature infants born as early as 22 weeks all the way to full-term babies who might have been born with birth defects or with some kind of an illness that requires intensive care. Philanthropy is a huge part of our story in the NICU. We were first formed as a result of a gift from the Gerber Foundation, and we continue to be blessed with donations from our community and support from our community on a regular basis. Everyday items that make the stay a little bit easier for families are also provided by dollars that you contribute. Equipment, large and small, education for our staff so that we provide the very best, ambulances, neonatal nurse practitioners. I could go on in the many ways that we've been supported through donations and support from our community over the years. Thank you so much to LEAD, both for participating in the tour and for your ongoing support. You make a difference in the lives of babies and their families every single day. Thank you so much.
Noah was born at 22 weeks and 4 days, and he weighed 1 pound 4 ounces and was 12 inches long, and you could see through his skin. We had to rub Aquaphor all over his body all the time because it was so delicate. He wasn't able to wear diapers because the diapers were too big. We found out we were pregnant with our daughter Gracelyn, and at 17 weeks my water broke at home, and she was born not alive. So we thought, okay, we're going to try this again, and we did, and then we had our son Duke at 20 weeks. Same situation, went to the hospital, water broke, and going a third time thinking, okay, this time's going to work, and I got a surgery this time, the cerclage that was supposed to help, thinking, okay, this is going to be good, and then kind of going through the same thing again and all those fears. Every day being pregnant was, okay, is this going to be the day that we lose him? Is this going to be the day that we lose him? I think we forget about it sometimes, and you talk to people and they're like, you realize this is like 1 in 10,000. He's a miracle. And it's like, wow. When you're living in it, you don't realize it, but then you start to think about it, like, it's amazing.
Yeah.